Dear friends, welcome back. I am Ashok Rajguru, your teacher, and you are attending the course on biochemic salt therapy or the tissue salt therapy. In this video, we shall be taking a look at a natural process called inflammation. Inflammation, as we shall see, is a process that is necessary for healing. And this video will give us the guidelines what we should keep in our mind before we choose a remedy for a particular ailment or suffering. Inflammation has been understood and studied in nearly every ancient tradition. It has been referred to in traditional Chinese medicine, in Ayurveda, and here we shall be taking a look at what Celsus, a Roman physician who lived around 25 BCE to 50 after Christ, and he has put it across very succinctly in these Latin terms. Here is a picture of Celsus, and this is what he has to say. Any inflammation will be recognized by rubor, which means redness, calor, which is heat, tumor, which is swelling, dolor, which is the pain that accompanies, and a loss of function because of the swelling. So this is nature's way of healing, and we shall just see how it appears. All of you have experienced it. It's only that I'm using Latin names to describe a process with which you are already familiar. We shall now look at the inflammatory response, which is part of the healing process, with the help of these graphics. Supposing a finger is injured by a thorn. So what follows is rubor and calor. That means there is redness and there is heat. There is heat and redness because our immune system has triggered the inflammatory process or the inflammatory response, which is sending more blood to that area. What follows is that there is swelling, and followed by the swelling there is pain. This pain is there to make sure that you do not overstress or strain the part that is injured. Following that, there will be some loss of function because of the swelling. So it's nature's way of immobilizing that part in order to allow time for healing. So we'll just go through the steps of the process of inflammation or the inflammatory response. As we said earlier, it's body's attempt to restore and heal. It will be triggered anytime there is an infection or there is physical trauma in the form of a blunt injury or a cut or a bruise. It could be a burn injury, or it could be simply exposure to excessive heat or cold. Secondly, it is accompanied by local heat and local reaction in the form of swelling, redness, increased blood flow. But also there is a systemic response. That systemic response consists of fever, an increased heart rate, anxiety. All these things are part of healing. So fever is very much a part of healing at the systemic level when the body has to fight an infection. If you cut yourself or there's a bruise, maybe the systemic response will be less pronounced. There could be an increase in heart rate. For instance, if you have suffered trauma in an accident, in that case, local heat alone will not help and fever is not required because there is no infection. So the heart rate and anxiety will go up in order to pump in more adrenaline and take you away from the danger and aid the healing process. Thirdly, inflammation will normally be followed by suppuration, which is pus formation in the area where there was an injury. And the next stage is granulation, that is when the tissue starts forming. After the tissue has formed, the body tries to eliminate any scar tissue that is formed over there. So, when you are making a choice of a biochemical remedy, you must match your remedy with the stage of healing. A different remedy will apply if it is in the stage of fever or chill. In case there's an hemorrhage, for instance, external bleeding or an internal damage to a blood vessel, it will be another remedy. While if the process of healing has reached the stage of suppuration, you will need yet another remedy. And during the process of granulation, you will need a different remedy. So you must look at the person, you must look at the stage of healing and then choose your remedy. We shall be coming across many remedies that will be taking into account each one of these stages of the inflammatory response. Now, after having studied this, I would just like you to ask yourself some questions. The usual response is an anti-inflammatory tablet and the use of ice packs for injuries in sports. Now, does it mean that the inflammatory response is a mistake, which I must control with an anti-inflammatory tablet? Is anti-inflammatory medication really advisable? And also, if part of the healing response or the inflammatory response is calor, that is heat, and rubor, which is redness, is it advisable to use an ice pack? We see sports people and sports persons doing this regularly. Well, you must understand and realize that the coach wants that sportsman to return to the arena as soon as possible. So aren't they sacrificing? Don't you think they are sacrificing the inflammatory response and the healing, natural healing process? You must ask yourself these questions and perhaps Google and find out more before you apply these methodologies. And remember, once you do this course and you understand the use of biochemical remedies, you will be able to take a wise decision on your own. So that brings us to the end of this video, and I'll just summarize what we have seen. We went through the inflammation process or the inflammatory response of the body. We understood the stages of healing and also that a remedy must match the stage of healing that the person is in. And under no circumstances should we interfere with a natural process. Thank you very much for your attention, and please keep up with your participation by putting your posts, your questions, and participating in the discussion that is going around. So thank you very much and see you in the next video. Bye bye.